The third principle, lean service delivery, is all about providing the adequate healthcare interventions at the right time to the right patients and to avoid unnecessary and ineffective care. And the Center for Sustainable Healthcare, they have done case studies to evaluate the sustainable value of healthcare interventions. And they let me use a couple of slides to exemplify this. In this case study, they did sustainability in cardiac rehabilitation. It's a case study of early mobilization by physiotherapists. So why did they do this? Well, early mobilization from 48 hours after admission to intensive care is well tolerated. It helps reduce muscle wasting. It's a powerful psychological motivator, and it shortens intensive care and hospital stay. And so what did they do? Well, 24 to 96 hours after open heart surgery, a therapist systematically initiated mobilizing patients. And these patients received 30 minutes of rehabilitation twice a day, continuing until discharge from the central ICU. And this is the evaluation part of the intervention. So they didn't only evaluate health effects or savings, monetary savings, but they evaluated health effects, monetary savings, carbon emissions savings, and also social effects on patient autonomy and staff satisfaction. And starting from the top, the health, patient had reduced ventilation days by 4 days. They also had reduced overall cardiac intensive care stay by 6 days. And this all resulted in total savings of £1,266 over 2 years. They did this during 2 years. And all this saved care, hospital days and ventilation days also meant savings of carbon footprint. So they saved 48.5 tons of carbon emissions over 2 years. And the purple figure at the bottom shows the social dimension, which showed a more rapid recovery, quicker discharge and return to daily life activities. Patients were actually more autonomous during their hospital stay. And this also increased staff satisfaction. So it was a win-win with positive outcomes on all evaluated measures, showing that putting physiotherapists where we are needed could actually save money, be good for health, good for staff, and good for the environment.